Hi, I'm Dr. Susan Daniel, and I am a neurodevelopmental optometrist in California. And I work specifically with non-speaking autistic and cerebral palsy and those with Down syndrome, help them be able to have the visual skills to learn how to communicate with the letterboard. And so I've been working with autistic kids since I have my son, who's 27 and is a non-speaker as well as a speller. And so that's how I devoted my practice towards this population.
That's awesome. My name is Matthew Thorne. I'm one of the board members of the Arizona Spellers Academy. We wanted to kind of do some things and talk to Dr. Daniels about vision therapy and developmental optometry and how that can help spellers when it kind of comes down to the use of letterboards. So thank you so much for being willing to kind of come on and chat with us today. I know one thing that a lot of parents are always concerned, or they're curious about, I think is a better way of saying, is how does these vision challenges commonly impact somebody who's on the nonverbal spectrum of autism, and particularly how does that impact their ability to learn or to communicate?
Well, yes. With the non-speaking autistic children, as well as young adults, there is a much higher incidence of visual problems. And some of that has to do with just the development of vision and that they need more experience in doing certain visual activities in order to learn those skills. So the first thing that we check is whether or not they need a prescription, whether they can see near or far, if they have astigmatism, and need glasses or not. And 44% of those who are non-speaking and autistic need glasses, and they found research for that. So then I get the question from parents is, how do you test a non-speaker to be able to check the prescription? And the good thing is that we do have various ways to do that. We have a specific instrument that looks at the reflex of light that bounces off the back of the eye. And then we add lenses in front of the eye looking at the reflex movement. And when the movement of the light stops moving, then we have their prescription. And that's how we check for patients with who are babies. My son had glasses at 5 months old because he had a very high prescription, and those with Alzheimer's, but then also just everybody who gets confused on which is better, one or two, we can still figure out the prescription. Now they have automated machines that can check this, but most of our kids have a hard time with automated machines. And so the skill of using a retinoscope, which is something that we learn in optometry school, but not every doctor is very skilled with that. But with my patients, since I do it all the time and every day, then I'm able to do it very quickly and be able to determine their prescription. The second part is once we have them seeing clearly, are their eyes healthy? And the health of the eye is very important for these kids because they have a higher incidence of ocular disease as well. Some of them have self-injury behaviors, so they may be hitting the side of their head or poking their eyes. And that can cause cataracts and retinal detachments, corneal problems. And that's really good to determine whether they have these issues. So we can make some changes in protecting their eyes as well as treatment of those diseases. Then we go into the development of vision. And what I mean by that is that vision intake skills, such as being able to fixate and follow a target, jump fixate from one point to the other, have the eyes work together as a team, and be able to focus near and far. Those are all learned skills. We are not born with having those skills in place. And so this is where our kids with autism need to have more practice in order for those skills to develop. And when they don't have enough practice, then they found compensating ways to get around the problem rather than learning the skill, especially as they get older. And this impacts their ability to use a letterboard for spelling because they may not be able to keep their fixation on the letters long enough to be able to look and poke at the same time. You wouldn't be surprised, if you have an autistic kid, but a lot of them will look at the letter they want and then poke and look away. And so they're not able to coordinate their motor and their vision simultaneously. And that has to do with apraxia. Apraxia is where there's a brain-body disconnect, where the brain knows exactly what they want to do. I want to move my finger and touch a letter, and I want to touch the letter B, but their body doesn't respond as well. They may be dysregulated. Their hand, they have a hard time gripping, into a fist and using their pointer finger. Their fingers, they may touch it with their thumb or, back of their hand, or they may not be able to even scan and look at the letters to be able to follow. So those visual skills are developed through experience with specific activities that give them the chance and opportunity to learn those skills to be better. And that's what vision therapy is all about. Now, once the visual input skills are developed, then we check to see how the processing skills are in their everyday life. Are they able to tell where their body is in space? Because that's actually a visual skill. We use our inner ear, our vestibular system, and our vision to tell us where our body is so that we can tell where things are and have depth perception in space. So you'll see those kids that have difficulty with where's my body in space. They're the ones that are touching everything, are spinning, are bouncing, are flapping, finger flicking. All of those things are like, where is my arm? So I'm going to be moving it and go, oh, that's my arm. And so it's one of those common autistic behaviors, but it's actually a visual processing skill. Now, one of the questions I get asked all the time is, so how do you do anything for that? And there's a lot of ways that we have as developmental optometrists to use different types of lenses and prism lenses in order to change the perception of how they see, and then do different body motor, intentional motor exercises to be able to develop the ability to process their visual information and do a motor task at the same time. It's kind of like rubbing your belly and tapping your head, being able to coordinate all of your body senses and to be regulated. And so that gives you a little bit of an idea of what we do from an examination sense, and any other questions you have.
Well, so when you kind of talk about the therapies and how do you make an improvement to that, how, what would a parent or a teacher or a caregiver kind of expect if you're going through vision therapies? Is there, are there skills that they see improving? Is it, being able to follow a finger better? Is it less flapping or, some of the autistic STEM types of things? What might see something that kind of shows you some progression that
Well,
this therapy is
that's a
making an
great
impact?
question because everything you said, you'll see with vision therapy. So say we have a student who is nearsighted, and they also have difficulty with jump fixations and being accurate, being able to look at this target, be aware there's another target in the space and jump right to it. And they have an eye teaming problem where the two eyes do not coordinate together as a team, so that the image of the right eye and the image of the left eye not only overlap but fuse to make one image. About in our non-speaking population, about 70 to 80% of autistic kids have an eye teaming problem that goes undetected most of the time. And so they may see double. So say you have a kid who needs prescription, has some eye tracking problems, and sees double. Um, that you can see can impair everyday life in so many ways. There's a lot of anxiety that comes when something comes close to them and they see two instead of like one ball. So you throw them a ball and they're like this. um, that happens, and you keep throwing them a ball and they don't get better because they see two balls. But they're not able to express that they see double. Even those kids who are speakers don't usually say, I see double, because first, nobody asked. And second, they don't know that that is not the way things are supposed to be. That's just their norm. I saw a double when I was a kid until I was 17, and I never told anybody that. And I just compensated by closing one eye and squinting. So there's certain things that we'll see. Closing one eye is a big thing, squinting, head turning, spinning, touching everything. All of those have difficulty with depth perception. So with
You mentioned
vision therapy,
apraxia.
yeah, go
With
ahead.
apraxia in the muscles, does that have something to do with the conditioning of the muscles around the eye as well?
Yeah, the eye muscles themselves are intact and they're ready to work. Like the hardware of the system is fine, but the software, the brain telling the signals to the muscles on how to move, that needs practice. Just like when you're first learning to drive a car, you're everything you're aware of. It's like, okay, I have to take it, put it in reverse. I have to look both ways, look in my mirrors. Um, all of that now just becomes totally natural because you've practiced it a lot. When you're first learning a skill, it's a frontal lobe, and then when it's become an automatic skill, it's the brainstem that holds on to it. With these kids, it's the frontal lobe all the time, and that takes a lot of energy to do. Now, in the eye muscles themselves are the most complicated muscles in the body. In that we have 12 cranial nerves, one that controls smell, one that controls taste, one that controls hearing. In just the eye muscles alone, we have 3 out of the 12 cranial nerves that just control the eye muscles. So if you have a speech apraxia and a global apraxia, you're going to have a visual problem with the eye movements. It just goes together with it. But the good news is that these skills are trainable. But if you don't know that there's a problem, then you don't know what things to do for training. And so these kids, they still have this problem into adulthood. And what the nice part about uh, doing the evaluations and being able to target and develop an individual program for each speller will help get the fastest road to going from I'm having difficulty to now this is an easy task. And so in that example that I was talking about, what we would do is with the vision therapy program is work with first being able to get glasses. And there's a whole procedure that we do to help with kids being less sensitive to having a frame on their face, because that's one of the things that is difficult with them.
Right.
We work on their reflex integration, which helps with that desensitization of the side of their head and the grasping, and there's a whole series of things we do with that. Then we do different activities that are intentional motor activities such as simple as putting a golf tee in a straw. Um, if you think about it, the golf tee and the straw, they see what the purpose is and that I'm going to be putting this in. They have to motor it. They have to keep fixation of it to have the depth perception. They may be trying to put the golf tee further, and then they have to make an adjustment. And then once they get it in, um, then we're really seeing how their depth perception is and how they learn how to control it by making those adaptations. Then we do it at different distances and all different things. And then we add like a prism lens. Now, what a prism does, it's a type of lens that moves an image. So if I put a lens in front of my eye, it will move the image if I see double closer together. So we can use that kind of prism. Or we can split it apart and their brain has to try to put it together. That's a therapy prism. And we have these different tools that we use that will, like weights on the system, like you first lift a bar and then you add some weight on it and you have to lift it and then your stamina improves. That's what we're doing with the visual system, using different prisms and lenses and the exercises.
Well, on that piece, then, can you kind of describe what maybe a standard, or I don't know if there's a typical vision therapy session, but what might be some things that you can maybe, refer back to what we're doing at the Arizona Spellers Academy. What might a therapist or a caregiver or teacher, what does a therapy session kind of look like to, help them on their weekly training? What are some
Well,
steps?
what's nice, working with the Arizona Spellers Academy is that they have very involved teachers and aides that are invested in learning not only the concepts of what I'm teaching, for the vision therapy, but doing it on a consistent basis. And they learn how to make adaptations in the therapy as we're going along. So say we have that same child that has that the eye tracking and the eye teaming problem, very common. So I would say out of the students that I've seen there, about 80% of them had those two problems. And so we would start with a motor function where they're having to look and tap a ball at the same time. Remember that look and touching for the letterboard is what we're going for, but that's a very high level. So we start with a lower level with them laying down on the floor so that their body is fully grounded. We hang a ball that's on a string above them, and they have to lift their arms and tap it. And you would think, oh, that should be a pretty easy task, but it's actually quite difficult. When you have them laid down and grounded, now they have like, where's my body in space a little bit better. But even extending the arms is difficult because reflexively, we like to be in the fetal position and trying to get extension is very difficult. So, but since there's a intentional motor test to where they can see and can feel their success, it's motivating enough for them to want to do it. And then we work on the control of being able to not just hit the ball, but to control it and hit it, a few times. And when you're doing that, what it's doing for the visual system is it's telling how far away is the ball, what's the speed of the ball, and how can I control it with my hands. So lots of things going on with just a ball and a string. Then we start adding difficulty by having them kick the ball instead of touch the ball. Then we'll have them sit up and touch the ball. Then we put prism glasses on it to where now they see two balls and they have to work to get the two balls to get to one ball. Then we'll use, a different type of prism lens that shifts the ball to a different place to where now they go to hit it, it's not there, so they have to look and touch. So it stimulates and teaches them to stay fixated on the target. Once they do that, and that becomes an automatic skill, then that fixation translates directly to the letterboard and to writing and to paying attention and getting body posture at the same time. You'll see in a lot of the kids is that they may be able to sit up nice and straight, but as soon as you have them try to look, then their body collapses because they can't do both of those simultaneously. So vision therapy has a lot of motor activities of the body that in addition to just moving eyeballs. It's not just moving eyeballs, it's having the visual system guide the motor of the whole body. So you'll see that we coordinate and very well with the occupational therapists that teach with music therapists. Music therapists work on the crossing midline and doing things to a rhythm because spelling is at a rhythm. OT is again working on the primitive reflexes and where is my body in space. And so that collaborative group and then teaching with the concepts to the teachers and the aides so that in every day these children are getting the experience in all areas throughout the day and not just during vision therapy or during OT or during music, but they're getting all of those activities built into the school. So what's remarkable about the school is that with the Spellers Academy is that they see the need for this and the benefit of having it. And we've already seen huge, huge progress in the kids with just even a few sessions that we've done. So what I do is I did the evals for all the kids and then set up an individual program. Then I do trainings for the teachers, some extensive training on what's the concept of vision. And then we do training on the activities. Then we do individual activities where the teacher and the student, and then me on Zoom. I'm guiding the teacher on how to do things with the student and give them set activities to work on for a month. And then I come back and we see, hey, you've mastered those. We're going to go to the next higher step and then the next higher step. So we're scaffolding it. What I'm finding compared to a lot of the vision therapies that we do at my practice is that it's going so much faster as far as the improvements because it's built into the school every day. As a parent, I know who had a son in many, many therapies, is that it was too much, it was too much for me to go, okay, I'm going to do a half hour of vision therapy every day in my house and cook dinner and, do homework and do all of those things. And so it's taught, but it kind of goes to the wayside. And I may get a couple times in there, but when it's built into the school as part of their curriculum, we're seeing the progress go very quickly. And that's what it's been very
That's
exciting.
definitely something we wanted to have built in as a weekly or even maybe a biweekly practice is that they kind of go through the assessments that you have and then they go through the practices that you kind of give them. You had mentioned that, once they kind of master or, show progress in something that you're raising that difficulty level. Is this something that they would technically maybe graduate out of to where they don't need to do those types of therapies? Is that possible,
Yeah.
or is there, something that this needs to be ongoing for maybe many years in their lives? What might be a perspective there?
Yeah, so it's completely variable on what their beginning difficulties were in the assessment. Like in the students that I've seen at the school, there's one kid who has great eye teaming, great eye tracking, but just has some primitive reflex issues that are going on. He'll graduate pretty soon through the program. And then those that have very complex, they have pretty much everything, that could be a challenge is a challenge for them. They're going to take longer. But what our end goal is our first goal is to specifically work on the activities that will help them get to spell. There's a lot of things we can do in vision therapy on visual perception and that kind of thing, but I target the therapy on getting the communication first, because once you got the communication, then we can work on the other things, and because communication is the most important thing that we can give them as a gift, is being able to express themselves freely. And then getting up from the 3 boards to the 126 letter board to a laminate board to typing the end goal is to get them to be able to type autonomously and be able to do it quickly and easily and with stamina. And that's my goal as a vision therapist, is to get them to that level. And that may take a while, or it may take a short time, just depending on where they're at. But what I've seen with since I do online vision therapy for um, uh, youngsters all the way up to adults, is that uh, they're getting there much faster than I expected. Ones that are on maybe struggling with the 26 board and trying to find the right letters, 6 months later, they're typing. And so and what's nice is that since most of those that are they're typing now, that they're open. So they're able to tell me and give me feedback on how much it's meant to them to have this opportunity to learn. And that's very exciting, as me as a professional, just to get that feedback, that they're, thank you so much. This is really helping me. Sometimes I get just a bye, because I maybe pushed them a little hard. But it's usually good feedback that I get, and they're very appreciative because their goals are my goals, and I go to what, especially when they're open, they can say, this is really what I want to do. I want to eventually be able to go to college. I want to learn as much as I can, read, by myself. All of those things are important to them. And I'm just like, okay, I can help you get to that point, from a visual perspective. And then, through the teachers and the OT and the music therapists, we're all going towards that goal and in that support. And in most schools, you don't get that. That's really what we
It's a different perspective. I mean, and I think that's the funnest challenge, is that, there are it's just a whole different concept of, from the vision piece to the regulation pieces to, adding the OT in there and how that all kind of combines together. You kind of mentioned going from like the 3-letter boards to all the way to autonomously typing. Um, can we share maybe a success story of maybe a student that you worked with that has gone through that transition? And
yeah.
do you see a lot of spellers that are being able to progress
Yeah.
to autonomous
I've
typing?
had quite a few actually. I've seen probably a couple hundred spellers in the last 2 years. I've had a great opportunity because I pretty much changed my whole practice to that's all I see is spellers now. And because they are my favorite patients. um, and and I get excited to see how it's changing their life. So for me, it's a little selfish, but I really want to help the spellers, and um, and especially those who were had just getting to the 26 board. They're going from a 3 board to 26 board. That's usually where I'm getting the patients referred to me, because it's a big jump visually to go from the big letters on the 3 board to a 26 board. And so those are where I usually get the referrals. Um, I've had about 25 of them in the last 8 months get to typing. And so it's been amazing and exciting. And we were just at a conference where they had a panel of spellers up at the front, and people in the audience were asking them questions, and they were typing, and I'm like, those are my people. Three of the people on the panel were in vision therapy with me, and I didn't even plant it, but they all said that that was a big part of getting them to be autonomous in their spelling. So, and feel better about having control over their body. That was a big part too, is that, you know, a few of them talk about their rogue bodies, that they want to control it, but they haven't had the tools on how to how to get to that control. And so we do a lot of motor exercises that give them that practice to get and over to where they see their own success. And then that's motivating to them to get to push themselves to that next level and to the next level. And
Talk
the
about that a
key
little bit,
to,
though. I mean, with the
yeah,
vision therapy and their ability to kind of get better motor control on their vision, how impactful is that to their regulation abilities?
it's huge. It's huge because remember we were saying we're doing a lot of this is my right side, this is my left side. I can control my right foot and my left arm and do multiple things at the same time, uh, visually guided, uh, that when you're able to do that, then they're like, okay, I have more control over my body now. And that regulation, uh, that feel good and the anxiety decreases. And so they don't have to have a lot of rogue movements because they're able to get to have that control over their body. And that's the part that a lot of the spellers are saying that they're just so excited about is that they just didn't know what to do to get to that point. And the key to therapy is to always not do something that's too hard, not do something that's already easy and mastered, but be right at the challenge level and then give them into small enough pieces that they're being successful at each step. And so that's what's nice. What I like about seeing the students once a month is that it gives them time to get that practice,
Yeah.
and they can see the difference. And then it's exciting for me, and then yeah, and then they feel that excitement, and then that carries them through that next month, that they're going to keep pushing themselves. And
How do you see
um,
that engagement with the students when you're getting on a Zoom call with them? Are you seeing more excitement or,
yeah,
I don't know,
yeah.
more engagement as they kind of progress from with you?
Very much so. At the very first sessions are usually like, who is this lady? And why is she on a TV screen, instead of being here? But it's the connection, it's like a three-way connection. Just like the teachers are always coaching the students, I'm coaching the teachers on how to work with the students. And I'm like, okay, now I want you to have them lay down, and we'll go through the steps on just getting their body to lay down on the floor sometimes. And then we're coaching the how to um, what verbal direction do we give and what kind of prompting do we do to initiate the motor movement, and then fade away the prompts. Those are all the things that I'm coaching the teacher how to do, because it's all new to them. This wasn't taught, to them in their educational career. But now they're getting a lot of aha moments to where they're saying, oh, I see what we did with Johnny works really well with, Elizabeth. And so, and because now they're seeing why,
Sure.
what the
That's
differences
important too,
are.
right?
And
Are you kind of
the,
getting that
the learning
feedback from
curve
the
has been pretty fast for them, actually. So
are you kind of getting those aha moments from the teachers
a
as
lot of
well?
aha moments,
Yeah.
especially for the teachers and aides are even in that first training session with them, they're like, "Oh, I wish I knew this a long time ago. I've been a teacher for 20 years, and um, it's just it wasn't ever explained to them, and because really I work with all the school districts here in San Diego, but they are for the most part, they've heard it at least a few times, but they're not as invested necessarily in the public schools. And with the teachers at the Spellers Academy, they're just like, give me all the information and I'm going to soak this all in. And it's working, because once they understand the whole reason behind it and the concepts and what we're moving towards, then they're willing to keep trying as well when they get they run up against a rock wall sometimes, and they're like, okay, now what do I do? They just email me, and I'm like, oh, this is how you change it. And they're like, oh, that worked, so that's the cool part about working together as part of that collaboration.
Sure. It's a good progression for them as well.
Yeah.
Now, if if someone is not in your area, or they're interested in trying to maybe look more local for a developmental optometrist, I believe that not all of them would have worked with autistic children, or may not have some of the same backgrounds as you.
Mhm.
Might be some good interview questions for a parent or a caregiver to ask somebody in their local area if they're kind of interviewing that type of person?
Yeah, that's a great question. There are when we graduate from optometry school, we have some basic training in vision therapy, but no training in vision therapy for autism. It's just not taught in school. And so the optometrists who are interested in working with this population do a lot of postgraduate work, and they can get board certified with the College of Optometrists and Vision Development, which is COVD. And so if you go to their website, www.covd.org, it has a doctor locator. So that's the first place to find those doctors who've done postgraduate work to learn on the full development of vision. And they're the ones most likely that will have experience with autism. And I don't think there's any developmental optometrist who doesn't have experience with autism. But I would say a good majority of them don't have as much experience with non-speaking autism. But they're still the best ones to go to at first in the list. And so a lot of people ask me if I know somebody in their area, and I'll look at the list too, and I go, oh yeah, I know that doctor, and that doctor is is well schooled in this area. But that I'm always willing to work with the doctors that may not have worked specifically with spellers, and I give them all my training and webinars that I've done that are specifically for optometrists on with over 180 videos of non-speaking spellers, and how I do the evaluation as well as the therapy. And I've worked probably with about 80 doctors so far just in the last 2 years on just sharing my knowledge. But the interview questions that you want to say is first, are you familiar with working with autistic kids and who are non-speaking? And if you aren't, then do you know somebody in the area that does? And what type of, are you checking for not just prescription and eye health, but are you checking for visual skills? And they will, if they're developmental optometrists, but the visual tracking, eye teaming, focusing, and visual perception, and then you'll be able to find somebody in your area. Sometimes, in some of the states, they have to travel a little ways to get there, and so some of the doctors also do online therapy for those that are more remote. But I have worked with even general optometrists and who are interested, one in South Dakota and one in Texas or whatever, so that they can take over the program and then consult with me. Because those are my two main things, as a professional, is teaching the doctors and helping the kids, and because I won't be around forever. And so, and I want to share what all of these few hundred spellers have taught me already, so that I can share that with all of the other doctors who are interested in this population.
I think
So,
that's what's so great about spellers, is how open they are to kind of really share a lot of that information. And once they can get that communication out, that they really want to do that.
yeah.
Do you think with the rising rate or rising rates of autism, in the country, do you think that this is becoming more prevalent with developmental optometrists, where they see a need for that, and then they're getting more questions in this area as
Yes.
well?
And I do a lot of lecturing all over the United States as well as internationally. And the number one thing they want is for me to teach them about non-speaking autism. That's and I lecture about all different subjects, but lately that's all they want to learn because the doctors are getting these patients and coming through their door, and they're like, we're not equipped, to work with them yet. And so they're just hungry for that information. So there's you can't go to a developmental optometry conference without having at least one speaker talk about autism. It's just becoming much more common because there's millions millions of kids that need to be seen, and we talked about how prevalent the visual problems are in this population, that they need to be seen more than like 100% of them need to be seen for the evaluation, 100%, because there's just such a high chance that they can benefit from having the examination and treatment. So
Just to kind of end things up, is there any advice that you think, you would like to give a parent or a caregiver about, just therapies in general, or, how to best approach, working with a nonverbal, or convert, helping them get into spelling?
Oh, into spelling. One of the things is if you have a child who is young, who is 4 years or younger. The one thing that I would have done totally different as a parent, my son is 27, so this is a long time ago when there wasn't as many autistic kids out there or therapies out there, is that I would have, since my son was non-speaking, I didn't talk to him as much as I should have, talk to him presuming that confidence, because he didn't speak, so I didn't talk. It was very quiet that we would do a lot of things together, but I didn't talk about our day, didn't read to him as much as I should have, talk about all these different subjects. Like we would go to the zoo, but I didn't talk necessarily about the giraffes and all of what's going on with the giraffe. And so that's what I would have changed, for the 4 and under. With spelling, I would start early, because these kids, I knew my son was smart. I knew it from the get-go. It's just I didn't have as much encouragement from the other providers that also shared that feeling that he was really smart. They're like, well, he doesn't know his letters, and he can't write, and he can't this, and he can't this, and he can't this. And I'm like, but now we know, boy, he sure knew so much. And he was listening the entire time.
Yes, they are. Yes, they
I
are.
would have subtitles on TVs. I'm hearing impaired, so I have subtitles. That's where he learned a lot of this, is and learned to read. Give him all those opportunities that of just listening to podcasts and getting that information in, even if it doesn't look like they're listening. I think that's really the key.
I think that's great advice. That was given to me. My son's 12 now, about 2 years ago, about, speak to them like you would any other child or anyone their age, and just have those conversations with them. And just the change that made in my interactions with him and him with me was just mind blowing.
It is.
The
Yeah.
engagement that we started having together was really impactful to kind of see more of who he was and what his abilities are. Because I think that's something that is probably the most confusing, is that you can really see that these kids are really intelligent, but you
Yeah.
just can't get the communication through a traditional system. So you don't know what to do.
Hmm.
And that's really what one of our goals is to bring more information out so people have more information to look into and find, to try
Yeah.
to help a nonverbal autistic child or anyone with some of those challenges, to find some alternative ways to start making an impact in their lives. So thank you
Okay.
so much for sitting down and sharing all this great knowledge with us.
Yeah, no problem. It was really fun. Thank you.